Hi, welcome back to my channel. So in this video I'll be talking about the distalization appliances in an easy way, and hopefully you will be able to identify it in the exam, the appliance. So first of all, we should know about the distalization appliance as to where is it indicated. So it is mainly indicated in class 1 skeletal malocclusion, class 2 dental malocclusion. Alright, then it is contraindicated in class 2 skeletal and class 1 and 3 dental. Alright, this is known. Then it is also indicated in cases of deep overbite. Alright, in skeletal closed bite. So let's just understand. So first of all, there are like extraoral, intraoral and intramaxillary. So in extraoral we have headgear. In intermaxillary you have Herbst, Jasper jumper. Then intramaxillary you have fixed and removable. Fixed may you have Jones jig and distal jet, and in removable you have ACCO and so on. So this is it. Then there is to what extent can you do the distalization. So that is done by Ricketts criteria. So in this we draw vertical from the PTM to the occlusal plane as well as to the distal surface. So PTM from the distal surface of molar, first molar, and then we see if it is a growing patient and we do age plus minus 3 mm, and in non-growing it should be around 18 mm. If it is less, then we do the if it is less, then there's a low possibility of distalization. Alright, so that's about the Ricketts criteria. Now let's talk about the appliances. So first of all, see this appliance. So this is a sagittal appliance. So this is a sagittal appliance, and you can see that here we will have unilateral, here we will have bilateral, and this will be bilateral with arch expansion. Bilateral plus arch expansion. Alright, now this is the classical sagittal appliance. Now let's talk about the standard pendulum appliance. Now the standard pendulum appliance, it was given by Hilgers, and you use a 0.032 TMA wire, right? And now you have to see how you are going to identify that. I'm going to tell. So you will see that there's a Nance button, and you see that we have occlusal rest on first or the second premolar. In this case it's on first. Then you have to observe the wire components. Alright, so just remember the standard one, and then all the modifications will fall back and you will just understand it very nicely. Alright, now let's talk about this one. So see the difference between this and this. So everything is same, and only the difference is between this, right? So this is Pend X. So what you mean by Pend X? So this is, I'll just wait a second. So this is Pend X. Now in this you have arch expander present, Hyrax. Alright, now see this one. In this is also same. This is Pend X. Then see this component. So you have an additional wire component, which is a locking wire soldered to mesiolingual aspect. So this, where is the jahan pe mesiolingual, there's this locking wire. This is T-rex. Okay, so this is Pend X plus this component, so T-rex. Now let's talk about this one. See, this is the difference. Now here you have a hygienic expander. So this is Hyrax, right? And this is what we call as Hilgers PhD appliance. Alright, so it provides expansion, yes, and you have to see here you have Koshgarian locks present. So if it is asked Koshgarian locks are present in which, so they are present in the Helga's PhD appliance. Now let's talk about this one. So in this there's a lot of difference. So if you see a design like this and there's something here, so it is distal jet. Okay, now in distal jet you see that this is the modification. You have a tube present. All right, so you have a tube present in the lingual acrylic button or Nance palette, and you have a bayonet to the lingual sheath, nickel titanium. So this is like nickel titanium open coil spring. Right, now see this one. This one is the easiest. See, I'll just give a trick. So this is ACCO appliance. ACCO appliance. If you see any anterior component, so anterior, so it will be ACCO. All right, but this is not the thing that you should like go by when you have to explain this. So ACCO is a removable distalization by Adams clasp on the premolars, right? Adams. Then labial bow is incorporated with the loop for headgear attachment. So this is the labial loop for headgear attachment. All right, and then see you have a finger spring also. So this is for the distal force on molar. Now transpalatal arch can also be used for distalization. So this is classic, right? Then this one. So this is repelling magnets for distalization. So in this you should know the name. So it was given by Giannelli, repelling magnets, and they work on inverse square law. So in this, what is A is repelling magnet, then A and B are repelling magnets, and this is the sliding yoke ligated to the premolar. All right, then let's talk about this. So this is Jones jig. Now this is characteristic, you will know about it. Now this is a fixed appliance. All right, and you just have to see this tubing and you will know that it's a Jones jig. Then fast pack appliance. Now in this you have to observe this and this. So the metal tube is somewhat in the Nance palatal and some out. So by this you will know that this is a fast back appliance. Now let's talk about this. So it's a K loop by, I think, Kalra. So yeah, so this, now this was a recent NEET question, so you should know. So this was NEET IBQ. Then let's talk about this one. So this was also like recent only, and I think it was NEET or AIMS that asked this question. And see, in Frog's appliance, now you will have the same as, if you remember, fastback, somewhat like that, and you will have these things, wire component. So through this is Frog. Now a lot of times we confuse it with T-Rex. So in T-Rex you just have a lingual locking wire extra. See, this is T-Rex. This is nothing like the Frog appliance if you correctly see. Alright, you just have this component and this component extra with the standard pendulum appliance. Alright, then this appliance. So this is the Carrier's distalizer. Now this is a fixed component. Alright, this extends from the molar to the canine. Alright, so this is Carrier distalizer and it is a fixed appliance. And you will see in this there's a elastic module present and there's a hook for elastic module. Now what it does is it is basically allows distalization of canine over alveolar ridge without tipping. All right, now let's talk about this one. So this is important, and it is Wilson's diametric arch. So characteristic is this thing that you have to see. So this is a compression spring which is mesial to first molar. All right, and you will also see sometimes class 2 elastics are also employed. Then this is also called as rapid molar distalizer. So this is important, or it is also sometimes called as Wilson's 3D arch, so on. Now this is our last appliance as far as I think. So this is our first class appliance. So first, let's write it. So this is our first class appliance, and this is like so in this you will basically see that we have a wire component and such component. All right, so this is mostly the thing, and plus there is also one more which I forgot to mention. I think if I can find it, just add it, which is TAD assisted distalization. If we can find a good picture. You can talk about this one. So basically you take like the assistance from TAD, right, the temporary anchorage devices. So just write it here. So TAD assisted distalization. Now in this now you have like where you will place the TADs. So in maxilla you will place it in the infrazygomatic screw, and in mandible you have a buccal shelf screw. So yeah, so if we have to sum up all this, so first we did sagittal. So if you have to like sum up, like just remember as I tell the names and components, you should have a clear picture in the mind. So in sagittal appliance, if you remember, we saw like this was it and this, then we saw like this, and then we saw ki yahan pe we have the expander, and here also we have this. So this was unilateral, then this was bilateral, and this was with the arch expander. If you remember, see this unilateral and so on. Then let's talk about the second one. So after sagittal, we talked about our pendulum appliance. So pendulum we had standard, remember, then we had pendex, then pendex plus we had something one was Hilger's PhD, and then we had T-Rex also. So standard was normal, like going like this. Pendex mein you had Hyrax incorporated. T-Rex mein pendex mein you had expander, and in T-Rex there was a lingual locking wire, 2 molar, remember, like all of it was same, like this was same, then this was same, and then there was one wire here. Okay, then in Hilger's you had Hyrax, so this was very clean and neat, if you remember. So see, this was our standard, and this is all standard. Then this was pendex, this incorporation, then this lingual wire, remember, T-Rex, and then we had Hyrax here. And plus you also have to remember in Hilger's you have Koshkarian locks. Okay, then pendulum, then we talked about TPA. So TPA was normal like this. Then K-loop was something like this between the molars. Then we had Jones jig. So Jones jig also had a characteristic like tube here, if you remember. So let's just go back and see Jones jig once again. Jones jig, yeah, this one. remember this tube, so that's Jones jig. Then we had repelling magnets, and I told you to remember G and LE. In this you have something like this, then like this, then like this. So like these are the repelling magnets, and this is the sliding yoke. All right, yoke. And then we talked about frog appliance. So frog appliance was like it was a square like thing, and then you just had this component in it, this one, remember, frog appliance. Then tad assisted, I told you. Then let's talk about ACCO. So in ACCO you had a labial bow, and then there was a finger spring also, right? And this was anteriorly, so this was loop for headgear, right? Then fast back appliance. Now fast back appliance was important. In fast back we had some this coiled ring, and then we had this corrector stick. All right, then ACCO we are done. Then we had this carriers, distalizer, then Wilson. In this now you just have to remember this loop, okay, compression spring, sorry. And this is the first class appliance, so like this. Yep. So this completes all the distalization appliances, important image based questions. So if this video was helpful, do give it a like,